Good afternoon, everyone.
Good
Welcome,
afternoon.
welcome again to the Third International Conference Amenet. For those who has joined us for the first time, this afternoon session, comprises two keynote speeches. In order to be efficient with time, questions will be shared with the keynotes after both presentations. Remember, please, that the chat is open all the time, so you can text during the presentation your questions and comments. Your message will be received by the moderator and they will be transferred to the speaker. Please specify the person to whom you would like to address your question. The first presentation of today is entitled Building Resilience to Extreme Weather Conditions, the Case of Healthcare Provision in Urban Ghana by Professor Samuel Codjoe from University of Ghana. Thank you, Professor, for attending today. Take the floor. Please use your 30 or 35 minutes for presenting and share your screen. Thank you very much.
Okay. Um, so can you see my screen now?
Yeah,
Perfect.
Okay. Thank you very much. And as you indicated, this does not actually relate directly with COVID-19, but we may be, as I present, we may be drawing some lessons from COVID. And so let me begin by saying that we know climate change is now regarded as the greatest threat to human health, because it has the potential to reverse the rapid advances that we've made in health over the last 50 years. Global mean surface temperatures, research has shown, are expected to rise another 0 to 3 to about 1.7 degrees Celsius during this century. And these increases in the surface temperature have been predicted to be greatest on the African continent. And in fact, this also includes the largest change in days when extreme temperatures are likely to impact population health. And so I show you a figure that has a projected deadly heat in cities. When we refer to deadly heat, we mean temperatures that are hovering above 37.6 degrees Celsius. And so this is for the period 1979 to 2005. And as you can see, there are the ones that are in black are already experiencing these kinds of heat stress. But on the West African sub-region, you have Lagos in Nigeria that had 8 days, and then Abidjan in Ivory Coast that experienced 19 of these deadly heat days. Now, let's look at how extreme climate events are going to link up with health. We also know that our planet is going to experience the risk of flooding. And Asia and again Africa are the ones, the continents that are going to be heavily hit. So for Africa, whichever way you look at it, whether it relates to heat or it relates to flooding, we are part of the story. In the last 3 decades, there has been a rise in the number of reported severe floods and the cost and the mortality associated with them. And so flooding is becoming the most frequently occurring natural hazard. In fact, after storms and earthquakes, will be reports that between the period 2005 and 2014, 2.3 billion people were affected by flooding and 94 million people by extreme heat. So these extreme weather events, that is flooding and then extreme heat, are linked to climate change, and they disproportionately affect the urban poor and their settlements. So how are these links linked with urbanization? Because urban populations are seen to be the hotspots of vulnerability to climate change. In fact, in many African cities, flood and extreme heat vulnerability are linked to urban poverty, informality, and populations occupying flat and or extreme heat spots. But what we have seen from the literature is that these issues are usually researched in isolation rather than holistically. In fact, the few studies we have looking at this nexus is related to flooding, and they do not include extreme heat events or examine the impacts of these events on urban infrastructure, including health service provision. So what are some of the knowledge gaps? We know studies from Sharikovat from the London School of Tropical Medicine has established the relationship between extreme weather and its influence on health outcomes and health service provision. But some of these, the evidence in some of these studies is very weak on the African continent. In fact, if you look at the WHO 2018 report, which has the Conference of Parties 24 special reports, they summarize and map findings from major studies on health and adaptation to climate change. But there was not a single study on West Africa. Therefore, West Africa has no regionally specific evidence on which to base plans for adapting health services to climate change. And then there was the UK Research Council's Living with Environmental Changes project that covered UK literature from 2010 to 2017. They highlighted two key areas that climate directly affects health. And one was direct infrastructural impacts on service provision, and then two, changes to the demand for services during extreme climate events. But although we know that some of these evidence from high income settings at least provides a basis for which we can look at these nexus, it lacks the relevant understanding of the confounding effects of the urban infrastructure challenges that are faced in these kinds of settings that we are dealing with, which is the low and middle income countries, including the lack of consistent connectivity to essential services. And some of these essential services include robust transport infrastructure, electricity, water, refuse collection, and sanitation. We all know that these issues are key in low and middle income countries, and they play a role if you are looking at the extreme weather and the climate nexus. And so these factors are important for us to consider. And so evidence is needed within West Africa to understand the challenges faced by health services operating with frequent exposure to extreme climate events, because these kinds of information will be vital to strengthen health systems in vulnerable areas and make them more resilient to climate change. And let me also mention that there have been a few studies that has to do with flooding and access to health services and flooding and mental health services. At least we can cite the case of Makanga et al. 27 in Mozambique. And that indicated that during these situations, there is a reduction in access to health services. Therefore, the number of people living more than 1 hour's walking distance from health facilities do increase by about 40% during flood events due to excessive water on roads. And the impaired access can be especially detrimental for people with chronic conditions who require frequent treatments, such as those with mental health issues. And Harris et al. Also indicated that flooding has psychosocial consequences, which is distress and potential poor mental health. We also know that hospitals house some of the most vulnerable at risk of extreme heat. If you take the elderly, if you take pregnant mothers, and if you take children, because these groups present with symptoms of extreme heat, fever, or conditions that are vulnerable to the effects of heat, such as cardiovascular events. And when you take the hospital buildings themselves, they can also be uncomfortable thermal environments for patients and staff during extreme heat events, with the potential to exacerbate health problems. And so, although temperatures are rising across the African continent, in fact, little is known about the temperatures that African patients and staff are exposed to. In fact, there was only one study in the Limpopo province of South Africa that had such data for outpatients. And it showed that indoor temperatures in the waiting areas were typically 2 to 4 degrees Celsius higher than the outside air temperature. And in fact, some clinics exceeded the maximum temperature of about 38 degrees Celsius. And so it's our conviction that health services need to be able to respond to extreme climate events in order to be resilient and provide quality services. So the aim of this project, if you will, was to explore the vulnerabilities of health services during flooding and extreme heat in two urban areas of Ghana, and then to identify the coping strategies that are being used to build resilience by both health service providers and community members. And we were of the opinion that the local perspective that will be provided will enrich our understanding of the vulnerabilities, resilience, and potential adaptations needed to enhance health service provision, not only in Ghana, but we can draw lessons for other low-income countries. And so, what were the study areas? As you can see on the map, we have Accra, which is located on the Gulf of Guinea, and then Tamale, which is further north of the country. So our analysis of temperature data shows that for both of the two cities, temperatures are rising because this data was derived from the airports in these two areas because they all have meteorological stations. And then when we come to flood, over the past 5 decades, Ghana has been affected by at least 17 major floods, which have cumulatively impacted more than 60 million people and resulted in at least 444 deaths, with Accra recording the most damage. We all know of the famous one, the June 3rd one, that a lot of lives were lost in the country. So what did we do? We had interview sessions, in-depth interviews in the communities. And then we also have in-depth interviews with health facilities, with the pharmacy, government health facilities, primary care and inpatient facilities, private clinic with inpatient facilities. And then we installed what we call tiny tags. And I'm going to show you a picture of that because that was our temperature measuring tool. As you can see in this picture, and this is a close shot of the tiny tag. It's a small device that you can hook to the building. In this case, this is a thatched house, and it is hooked to the roof. And then it's more visible here. And it records temperature every 10 minutes. And then we do downloads, I think, after every 2 months or so. So that was tons and tons and tons of temperature data that was gathered. And the tiny tags, they came along with these forms. So the forms will indicate the community in which the recording was done, the city, and then the coordinates, some site elevation, the height of the building, and quite detailed information. We even have the building type, and then the materials for the wall and roof, and if there is any artificial heat source, because we need to calibrate all these and calculate. So if you can see it, whether there was a TV and a fridge in this instance, and then also ventilation and other information, very comprehensive. That's the tiny tags. These forms accompany the tiny tags. Then I show you some images of some of the interviews. These were in Home and Ward K and Gumani in the Tamale area. And I also show you area views of some of the locations or the houses that we had the tiny tags. So you can see them, the tiny tags in yellow. This is also in the Tamale area. And then for us to have a reference site, we placed some of these tiny tags. So as you can see our tiny tag, we placed them besides the Stevenson screen, and this is the Tamale Airport. So we had an idea of what the Stevenson screen at the airport was measuring, and then we related it to what our tiny tag was also measuring, and then we could also relate it to the other places and the hospital facilities and the houses that we've installed the tiny tags. So what were some of our findings? And so I show you pictures here and some of the temperatures that were experienced here in Accra. If you look at this woman in a cooking area, this is very popular in Accra. You can have what we call the mini restaurants, or we call them the chop bars. And this is a typical one. Temperatures that were being recorded, there was around 48.1 degrees, and this is very high. You can have examples of some people's living room, and then the meteorological site. So please note the difference in the kinds of temperature we are recording in the meteorological site as compared to the actual temperatures that people were experiencing in their work environments and in their homes. Because for most of the times, what the meteorological station or the news will present to us is the temperature that is peaked at these meteorological sites. But as this study is showing, there is really a significant difference between what is normally reported on the news and the actual temperatures that people experience. This is a picture of it's a very popular thing now in Ghana. You find a group of young men and women who cramp themselves into so-called cinema houses watching English Premiership football or football from somewhere else in the world. Then maybe a Spanish football league, when there is the Clásico, for example, Real Madrid, Barcelona. It's a big thing here in Accra as well. If you don't know, it's a big thing. And you have young men and women filling up these cinema houses because they can't afford to pay some of these services, these DSTV services. So they all cramped in these facilities and pay very small amounts to watch some of these games. And we recorded about 38.7 degrees Celsius in some of these cinema houses, which can be very detrimental to the health of these young men and women. And then I also show you some temperature recordings in the ward, and then the thatch house, which you can see is significantly cooler. And so probably we should be thinking of going back to have thatch for our homes instead of the aluminum and the roofing sheets we are using. Then I turn my attention to Tamale. Of course, as you saw the locations of the two cities, Tamale is further to the north. So expectations are that it's going to be much warmer. But look at this poor blacksmith old man who was experiencing about 61 degrees Celsius in his work environment. 61 degrees. This is amazing. I mean, we know blacksmiths do generate a lot of heat when they do their work, but to experience 61 degrees, that is fatal. And then we had some of the living rooms and other areas. But you see, look at the recording from the airport meteorological site, 41.5 degrees. And so if you are deceived by this figure, I can tell you that what is actually happening, look at somebody's, this seamstress is working in her shop, 50.3 degrees. And she complained to us that because of the heat, she gets fatigued and tired very early. And this is one of the study communities in Accra. Don't try and pronounce it. It's called Agbobloshin. And I project this to give an idea of the nocturnal heat islands that is also recorded, because these places do especially heat up at nights. So I also show you some graphs. This, for example, has to do with typical indoor temperatures at the healthcare facilities. So if you look at the children's ward, the maternity ward, outpatient department, the labor ward, it gives you an idea of the minimum and maximum temperatures that is being recorded. And if you compare all that to the meteorological sites, you see the meteorological sites have a high range. And as I told you, the tiny tax takes temperature recordings every 10 minutes. So this is showing from 000 hours up to 23 p.m. So the entire day. And this is what happened in one of the wards. The key thing to take away here is that if you look at the maternity ward and the children's ward, in terms of the temperatures, they are behaving almost the same. But if you look at the airports, there looks to be a vast difference between the readings in the airports and these hospital facilities. As far as the very early morning, the temperatures are concerned, and then the late at night temperatures. So it is extremely cooler at the meteorological site, but they all link up around the peak of the day when we experience the maximum heat. Okay, but then as it goes down, you see the meteorological station dropping drastically as compared to the other wards. And then we followed some of the health workers to their homes so that we could also have an idea of some of the extreme temperatures that they were also experiencing. And by and large, and depending on whether your roof is metal or whether it's touch and all that and other conditions, you may experience much higher temperatures. So let's now turn our attention briefly to look at how this impact of the extreme heat on health facilities. So what our study found was that all health facilities on an average were 5 degrees Celsius warmer than the meteorological site. And this is a big thing, 5 degrees Celsius warmer than what we are normally told. And we attributed this to the greater thermal inertia of buildings and the influence of urban heat island. And then mean indoor temperatures for all the health facilities were about 1.7 degrees Celsius warmer internally than Accra, which of course we all know. But then the opposite is also true, because mean night temperatures are also slightly cooler internally than Accra. And so in situations like this, there are more respiratory problems. There's dehydration, issues of hypertension, strokes, cerebral meningitis, asthma, boils, and heat rashes. We also know that, and it was evident from, and this is a picture of one of the hospital facilities in Tamale. We know that poor ventilation exacerbates heat. And we also know that fans are no longer effective when the temperature hits about 34 degrees Celsius. Because what we then say is that it begins to blow more heat. And when all this happens, it limits the ability of health workers to discharge their duties. In fact, there were instances that where a surgeon told us that sometimes because of the sweat they have, there's a possibility of sweating into open wounds during surgery. And we all know this can, there's a possibility of reinfections. And because of power outages that normally do occur during these extreme heat conditions and flooding events, there were some of the hospital facilities that indicated that they had to set up intravenous fluids and sometimes to do surgeries using mobile phone lights. So these extreme heat brings about disruption to infrastructure. And there could be issues of lack of water and power outages, as I mentioned. And when you have situations like that, it has implications for hygiene. Another issue also is that, and this I think we'll have to grapple with when there's a rollout of the COVID-19 pandemic, the vaccination in this country. Because when there are periods of extreme heat, the pharmacies, they lose their refrigeration and sometimes drugs are damaged. And so the vaccination cold chain storage facilities are affected. So you have all these young nurses that have to use ice blocks to put in containers when they are doing the vaccinations. to go around. And so during periods of extreme heat, these are not so effective. There are also issues of overcrowding, because around this time of the year, a lot of cases are reported to the hospital facilities. And so in some of the hospitals, they told us they do mixed admissions. So you can have children that are being admitted in adult wards. Sometimes females are admitted in male wards, and people with malaria cases are sent to the surgical wards. These are all problems, challenges that they are confronted with, and they try to see how they can be able to circumvent some of these things. But the flip side of the issue also has to do with the challenges the health workers themselves have. Because when your room is warm, it is very difficult to sleep at night. And once you are unable to sleep, then it increases fatigue. So you come to work already tired, and sometimes it can elevate the risk of errors, especially when we are dealing with health workers. Now, how are they building resilience to these extreme heat? First of all, some of them are trying to install large windows and doors with nets to increase ventilation. And there is this issue of solar-powered air conditioning, although they are very expensive. And then they also lobby the power companies to give more information on power outages. The issue of fuel supply to run generators. These are very expensive, especially for the private hospitals. But they hoped that the early warnings for extreme heat and even for the floods could be generated, so that, in their view, that will lessen the issues. So let me quickly look at the impacts of flooding, and then I will conclude. During periods of flooding, there are more cases of typhoid, malaria, respiratory infections, cholera, gastrointestinal problems. And so there's this issue we have here in Ghana, which is called the no bed syndrome. No bed syndrome. Because when you do have increase in cases, and the cases are sent to the hospitals themselves are filled up. And so they keep telling you, we don't have beds, we don't have a bed. So there was one medical officer we interviewed who had a personal experience with the wife of his colleagues, who got suddenly ill in the middle of the night during this peak period. And according to him, they went from hospital to hospital, from hospital to hospital, and there was no bed. So they kept going. And then the issue that started somewhere around 11 p.m., in the end, they could locate a hospital bed space around 4 a.m. in the morning, when it was too late. So the colleague lost the wife under that condition. So these are some of the instances and some of the experiences that people live during these periods. In fact, flood waters could go as high as waist level. So when it happens, the hospitals, they try to move their equipment to higher grounds. Sometimes there are issues of damaged generators. They lose their medicine supplies and equipment. And there are even challenges working in between the buildings of the hospitals, because there can be accidents on some of the muddy surfaces. That was reported. As I indicated earlier, what the power companies do in this country is that they will normally disconnect the electricity during these extreme events to avoid electrocution. And that also has effect on the operations of the health facilities. And then there are some communities are isolated from the services. And so this poses a big challenge for those who are on regular medications. So if you take, for example, mental health patients, if you take diabetic patients and people with hypertension who are on regular medications and may have to report to the hospital to pick them, during periods like this, they are the ones we have to think about. Then one of our respondents told us that it looks as if there is limited support for stress effects of floods. We normally concentrate on the physical effects, but when it comes to the mental effects, we do not have very good programs that we have to look at. And that the emergency response to floods largely focus on physical health, and we also need to consider medical health. So how do they also build resilience to floods? In some instances, they indicated that they mobilize the community members to clear the rubbish drains, so that blocked gutters they can have flow of water. Sometimes they build raised areas for their equipment and supplies, or they build walls to stop the flood from entering the wards. And occasionally, they do request more staff during rainy season. Just as the case was with the extreme heat, in periods of floods, they were also of the view that there could be early warning systems. There was a need to link the warning systems with existing health systems and other communication platforms. And then the staff need to be trained as to what to do with the information. And then the early warning systems also has to be reliable. In conclusion, I will say that the vulnerability to extreme weather events in cities projects gave us a rare opportunity to investigate the impacts of extreme weather on healthcare provision in a low-income country setting like ours. What we found out was that communities are already enduring extraordinary temperatures in their homes, as well as public spaces and workplaces. And communities are also facing multiple health threats from heat, flash floods, water, and vector-borne diseases. And so, city regions of the global south are in the front line of global change impacts, but some adaptations we believe could buy time. And let me take this opportunity to acknowledge my colleagues from the University of Loughborough and the University of Development Studies that undertook these studies. I thank you very much.
Thank you very much, Professor. Very interesting work. After the second presentation, we will be sharing our questions and comments with you. Please remember that you have the chat open to put comments and questions. And now we would like to invite to the second keynote speaker. He will be presenting the research entitled Post-COVID-19 and Public Service Delivery in Africa, Issues and Opportunities. This is Professor Joseph Roland AKWETEY from University of Ghana. Thank you, Professor. Take the floor, please.
Okay. My name is a very short name, is Ayee, but people have. Okay, so thanks for the invitation. I hope you can see my slide.
Yes, we can.
Okay, you can see the slide. The title of my address is Post-COVID-19 and the Public Service Delivery in Africa, Issues and Opportunities. First, I would like to thank the organizers for this invitation to present a paper. So in this paper, I am discussing about 3 or 4 issues. First, I want to look at the issues and opportunities of post-COVID-19. What are they? And in my introduction, I'm going to make the point that COVID-19 is a wicked problem and a disaster risk. And so when I come to the introduction, I'll define what a wicked problem and what a disaster risk is about. The second issue is I'd like to look at the public sector in Africa and service delivery. My colleague, Professor Codjoe, has made some important points about service delivery. So I want to look at that. Then the other thing I'd like to talk about is the post-COVID-19 public service delivery issues in Africa. And then, of course, I'll look at the post-COVID-19 public service delivery opportunities. I always say that in any calamity, there is a ray of hope. So even though we are all literally condemning COVID-19, there are very important good things that it has brought. So I'm going to highlight that, and then I'll look at a few lessons or the takeaways. So, coronavirus disease 2019, COVID-19 for short, qualifies to be both a wicked problem and a disaster risk, in spite of the advanced science and technological world that we live in. So what is a wicked problem? In the political and policy sciences, a wicked problem may be a pandemic, may be an event, may be a natural or unnatural disaster that is complex, it is intractable, it is unstructured, it is cross-cutting, it is relentless. And COVID-19, it is difficult and impossible to deal with. And COVID-19 has actually got these characteristics. We are talking about the first wave, the second wave, the third waves. We are talking about increasing cases. We are talking about mutations and variants or strains. We have the Brazilian strain, the UK strain, the South African strain. We are talking about new terminologies, the new normal, the protocols, the social physical distancing, PPEs. So when you are dealing with a wicked problem like COVID-19, you are dealing with a complex and difficult pandemic. That's what we talk when we say a wicked problem. Then, of course, it is also a disaster risk. COVID-19 is an unnatural disaster. That means it didn't come the natural way. It was artificial, right? And why do I call it a disaster risk? It's a disaster risk because it has affected several people. So if you look at the global figures, 110 million people affected, and out of the 110 million people, 2.4 million people were affected. In Africa, we are talking about 4 million people and 100,000 deaths. In Ghana, we are talking about 90,000 people and about 600 deaths. So even in terms of loss of life, COVID-19 is a disaster risk. But the other point which I want to stress is that it also leads to the loss of livelihoods. Several people have lost their jobs. If you have not lost your jobs, then of course your salary may be reduced by 60%, etc., etc. But then the other thing is that there are restrictions, there are health issues, economic problems, movement of people, but its infectiousness and the mode of transmission is unparalleled. They are very unparalleled. So the entire globe has been affected. It has brought governments, health, the economy, education, society, the culture of countries. COVID-19 has brought them to their knees. Even though vaccines have been introduced, have been made, there are still, and for the very first time in the history of the world, vaccines have been discovered in a rush. Within under 1 year, we have vaccines. So that's why it becomes a difficult issue now for people to be educated, because people in Africa are afraid of vaccines. They say that because of the adverse effects of vaccines. So even the point is that even if you have been vaccinated, you still have to wear your mask and follow the protocols. COVID-19 is a wicked problem and a disaster risk. Now, so I want to move on to the public sector in Africa and service delivery. Of course, you see, Professor Codjoe made very important points about the poor quality of service delivery in Africa: education, health, sanitation, water, electricity, security, etc., etc. So even though in the Western countries, the public sector is literally irrelevant. In Africa, the public sector is still very important. It performs three or four important functions. It formulates economic and social policies. It designs and implements public programs. It raises revenue, and it manages accountability. And one of the things that citizens like is effective service delivery. And so when they feel that institutions are performing their functions well, it builds the trust and confidence of people in the public sector. The citizens feel that the public sector is accountable to them. But if we have ineffective service delivery, the citizens lose confidence and trust in the institutions. The public sector loses legitimacy, and they feel that the state is not also accountable to the citizens. And so, if you look at the public sector in Africa closely, there have been several complaints from politicians, from governments, from citizens about ineffective service delivery, education, health. Prof. Codjoe has actually outlined them. Poor health service delivery, poor education delivery, poor security issues, sanitation issues, electricity, water, etc. They're all in a mess. So because of the complaints, because of the ineffectiveness in service delivery, the Bretton Woods institutions, governments themselves have led reforms in the public sector. But I want to say here that COVID-19 has exacerbated the weak service delivery capacity of the public sector in Africa. It has exacerbated the problem. And I'm going to deal with that. One, the other thing we need to also look at that we have very weak institutions. They are poorly resourced. They have been politicized even in terms of appointment of personnel. Therefore, these institutions cannot perform their functions well. But in the midst of the weak institutions, we have a very few good institutions which are doing their work well in some sectors, in the banking sector, in the trade area, and a few other areas. But the point which COVID-19 has also brought is the weak preparedness to deal with disaster risks like pandemics. The public sector has been exposed that it is unprepared to deal with pandemics such as COVID-19, which is a very rapacious, ravaging virus. It does not look at the status of people. It attacks everybody, whether you are high, whether you come from the high class or the low class. COVID-19 defies any class in society. So it has also exposed the unpreparedness of the public sector in Africa. Now, so what are some of the issues that post COVID-19? Because now we are thinking ahead that this is what COVID-19, it has caught all of us unprepared. Even the Western countries, even the scientific, technological advanced countries in the world have been brought to their knees. So what has post COVID-19, if you are dealing with public service delivery issues, what are the key issues that we should be looking at after COVID-19 has left us? The first issue is that we need to design a way of financing disasters like pandemics, which will also improve our preparedness. Whether we like it or not, in Africa, COVID-19 has exacerbated. It has caught us unawares. Unlike even in the Western countries, it has caught them unawares. But in Africa, it has caught us more unawares than the Western countries. In Africa, we're lucky that we did not experience the huge, massive infection rate and the death rate. As I said, in Africa, the infection rate, how many people? 4 million, 100,000 people had lost their lives. But we need to reopen the debate about how to finance disasters. And politicians, they feel that, oh, disasters, will they come? Oh, the future, we don't know the future. God is in charge of the future. So what's the big deal? When it comes, we'll see, we'll pull our resources together. But COVID-19 has taught us that everybody must be prepared. So money is key to fighting pandemics, disasters, and wicked problems. We must do that. It's very important. We've taken that for granted for a very long time. The second issue that I'd like to flag is that whether we like it or not, after COVID-19, most services or some of the services will be provided online. So e-government and e-governance. It's a very important issue now. And of course, even though we started in Africa, online services had lagged behind. I was pleasantly surprised recently. About 2 weeks ago, I went to post. I wanted to post a letter in one of the Accra post office to the UK. I have to fill a form to send to the bank about my tax returns over my earnings there. And to my surprise, the post office said I can't post the letter because there are restrictions in the UK, so my letter will not get there. So I should wait until the restrictions are lifted. That's it. So if there is online service, it will be so online service like email, like fax, it will have gone. But I look at the bank's address, they were insisting on the fact that they need a hard copy of the form. But what will happen in Africa is that people have now realized that they must improve on online service, completion of forms. It will also reduce the face-to-face contact, which will also reduce corruption. So online services are going to be improved, e-government, e-governance, etc., etc. But the next one, which is related to the online thing, is the digitization, the conversion of text, pictures, and sound into digital form. And this is very important because people have been talking about e-learning. The universities have reopened, and all universities have been asked to engage in online learning. So lectures have been taxed, right? So we are using Zoom to teach our students. One of my students is in South Sudan. Every Monday morning, he logs in and I teach. So it's a very important issue. COVID-19 has taught us that we need to digitize. We need to be able to teach. We need to be able to learn. But that also brings into fore the whole issue of expertise that people, both faculty and students, will need to have, will need to learn. So we need to provide the necessary infrastructure. And so the telecommunication companies will need to expand their bandwidth so that access to the internet, access to other online learning procedures can happen. So digitalization will be an important feature in the post-COVID era in Africa. But the fourth issue, which I want to flag, is the whole issue of we need to undertake drastic reforms in the policy and institutional framework for service delivery. There are some problems. We have policies on pay, policy on education, policy on health, policy on electricity, on water, on agriculture, every sphere of life. But are those policies still relevant in the post-COVID era? I bet you some of them will have to be changed. In certain areas, the policy framework will have to change. The same applies to the institutions. How competent will be the institutions to perform their functions? Maybe The institution's mandate will have to change. They have to be reformed or recrafted, etc. So the institutional framework for service delivery will have to change. Maybe public-private partnership will have to be promoted. Collaborative governance will have to be promoted. The state may have to move away from providing certain goods and services. So there should be reform in the policy and institutional framework for service delivery. The fifth issue that I want to flag here is the whole issue of most of or some of the institutions working in silos. In Africa, institutions don't collaborate. So there are overlap in their mandates, overlap in their functions. They don't collaborate, they don't coordinate. So the time has now come for the institutions to actually collaborate and coordinate so that all overlaps and passing the buck, not doing their functions well, etc., will be. So we need effective institutions, actually. Then, of course, you see, I realize that this conference is about regional integration. And one of the things we need to see in the post-COVID-19 era will be we need to strengthen regional integration through effective collaboration. I think the fight against COVID-19 has not been regional as would have been expected. So it was basically individual countries. Of course, I agree that the discovery of vaccine was collaborative among institutions. But if you are talking about regional, the West African region, the African region, there has been little regional integration, collaboration in fighting COVID-19. And COVID-19 has taught us that we can only fight pandemics or natural disasters if we are able to strengthen regional integration. So regional integration is very important. We also need to improve public education on the observance of the protocols. One of the things which has come up is that even in spite of vaccines, the protocols will need to be observed again. So it needs improved public education. And as I said, in Africa, people are not comfortable with wearing masks. People are not comfortable with even the vaccine. So there needs to be improved public education that COVID-19, in spite of vaccines, is still with us, and therefore we need to observe the protocols. Then you see, one of the things that what we have seen is that under COVID-19, public service delivery has been politicized, there has been discontinuity in certain areas. There has been political economy issues. Some governments have used resources to actually, which have benefited their supporters, which have benefited their ethnic groups, which have benefited their governments or themselves. So there must be the need for policy continuity and a depoliticization of public service delivery. We must depoliticize public service delivery. That is, every citizen must be open to enjoy public services. Because if you look at it, there are rural areas which have been neglected in public service delivery. The delivery of public service is actually concentrated in the urban centers. We need to decentralize, more decentralization of public service delivery to the rural areas. The final issue which has come up is that whether we like it or not, we have to fine-tune ways and means of achieving Agenda 2030, the Sustainable Development Goals, and then Agenda 2063, the AU's Africa We Want. These are very important developmental blueprints, and they are lagging behind. The achievement of the targets are lagging behind because of COVID-19. In the post-COVID-19 era, we need more effort at trying to see how best we can fast-track the achievement of the targets under Agenda 2030 and Agenda 2063. Now, what are the choices? What are the opportunities? As I said, in any calamity, there is a ray of hope. And what are the opportunities that post-COVID-19 public service delivery has actually brought to the fore? The first one is we need transformative leadership at all levels. Whether we like it or not, it is leadership which will change the face of post-COVID-19 as far as public service delivery is concerned. If we have weak leadership, ineffective leadership, we are not going to get there. In fact, the president of Ghana made a very important point when he was, now the president of Ghana has addressed the nation 23 times. It is within 10 months, the president of Ghana rarely speaks. But the president, because of COVID-19, has been forced to more or less averagely speak to the nation twice a month, 23 times. From March to date, he has addressed Ghana. And he made a very important point, I think, in one of his addresses, that they know how to fix the economy, but he does not know how to bring people back to life. It's a very profound statement. You can fix the economy, but you cannot bring people to life. And so that is the essence of a transformative leader, that a leader people must be concerned. So which means changes must come in all areas. Changes, lasting changes, which will be able to deal with post-COVID-19 issues. The second issue is that we need to build stronger institutions. Our institutions are weak in Africa. That's why they are not able to perform. And because of the politicization, because of appointing of people not on merit, meritocracy has been sacrificed at the altar of politicization. So we need to build stronger institutions. And of course, SDG 16 on peace, justice, and strong institutions is there. It has become the main pillar for achieving all the other Agenda 2030 goals. So let us build stronger institutions, because post-COVID-19 is going to bring a lot of challenges in public service delivery. And so you need stronger institutions to be able to perform their functions. We need to deal with political economic issues, that the politician must promote the public interest and not his party interest or his ethnic interest or other interests. We need to move away from politicization and excessive partisanship and deal with the public interest, promote the public interest. Public service delivery is about the public. So the public interest must be served. So political economic issues which will border on individual interests, partisan interests, etc., we need to deal with that. This is a very difficult issue, but that is why you need a transformative leader who will say that I'm ready to promote the public interest and deal with the issues. Then, of course, more and more citizens would like to have satisfaction on how public services are going to be delivered. Very important issue. Citizens will be demanding for more effective, efficient public services must be delivered. Then, of course, we all know that the state cannot do everything. The public sector cannot do everything. So we need to strengthen public-private partnership. It's not happening in Africa as expected. The state is very pervasive. It is understandable, but the state cannot do everything for Africa. And that's why the private sector itself will need to do a lot of things. And so in terms of health, in terms of trying to build a stronger economy, in terms of education, in terms of other areas. So we need to strengthen public-private partnership. We need to digitize public services, have already online services, etc. But of course, we also need to have effective decentralization. African countries have talked about, or they have undertaken reform on decentralization. Ghana, for instance, 1988, we started with decentralization. But what we are practicing, or what most African countries are practicing, is what I call centralized decentralization. You decentralize with the left hand and you centralize with the right hand. So we need to move away from centralized decentralization to what I call functional and effective decentralization, which will also help us, because whether we like it or not, the principle of subsidiarity is very important, that the functions which are performed are better performed at the lowest level than at the central government level. The final point about the public sector is that, you see, whether you like it or not, there will be new internal organization processes. Now, people will not have to go to their offices. There will be more online meetings, more processes being experimentation of new modalities of work. So people are now being asked to work from the house, from home, etc. So there will be new internal organization processes. And how do you also evaluate the performance of people? So new ways of working within organizations would face us during the post-COVID era, that we may have to continue with online meetings, online lectures, working from home, presenting papers on webinar, etc., etc. The takeaway, what are the lessons? My conclusion. As I said, African government needs to budget for disasters, such as pandemics. It's very important that we have African governments have not been interested in disasters. Disasters, will they come at all? And of course, because they feel that they will not come at all, they don't feel compelled to allocate money for them. So we need to actually look at that. Then we also need to revitalize the importance of frontline workers, or what others will call street level bureaucrats. For instance, doctors, nurses, engineers, teachers, policemen, etc. We need to actually look at what have they been doing. And mind you, this COVID-19 has exposed the vulnerability of street level bureaucrats. Doctors, nurses, other health professionals, teachers, security, the police, etc. It has actually exposed them. So we need to revitalize the importance. Maybe we may have to design new conditions of service for them. We also need to build an effective public sector and its workforce. We have been talking about this. Let us have a stronger public sector workforce. Personnel, how are they recruited? How are they promoted? But in Africa, some of them, or majority of them, are either recruited based on their partisanship, or they are promoted based on this. And the mere fact that when a government comes to power, it has the tendency of moving those bureaucrats who they don't want to work with. It doesn't help it, because in Africa, when you move people out, of course, what comes out is that we have a void or a gap. We also need, there will be more public demands for quality public services and greater citizens' involvement in public service management. Now, post-COVID-19, there will be more agitation from citizens about effective service delivery, either in the rural areas or in the urban areas. Citizens are now going to hold public officials accountable in effective service delivery, and we need to prepare for that. Otherwise, there will be several agitations which will make governments not stable enough. But we need stable governments to be able to deliver services. Then, of course, as I've said, we need improved public-private partnership, and then improve infrastructure in service delivery. We may also need to improve mechanisms to monitor public service delivery. Now, one of the things that we have seen in Africa is that benchmarks are not there, or they are not there. And so therefore, we need also to improve mechanisms to monitor public service delivery. And that's why civil society organizations will need to be more proactive in this area to help citizens to monitor public service delivery. And finally, post-COVID-19, one of the lessons that what I want it has taught us, or one of the takeaways is that we need to develop more pockets of productivity. That there are certain institutions, they are few now, but post COVID-19 has taught us that we should develop more pockets of productivity. That is, institutions which are effective in spite of operating in very difficult and fragile environments. We need to have more of them. More successful institutions must come, more effective institutions. They are painfully few in Africa, but we need to grow more of them with the necessary support, with the necessary reform, which will help us. So, in a nutshell, I would say that COVID-19 is tragic, but at the same time, it offers opportunities and windows of opportunities for all of us to actually grapple with the problems and the challenges that it has brought. Thanks a lot. I'm done.
Thank you very much, Professor, and thank you both of you for sharing with us these interesting reflections and works. Well, we are more than 40 participants here. Now we have some minutes left, 5 or 10 minutes that we can use for questions. There are some comments in the chat, and let me inform you that yes, we are recording all sessions, and we will be uploading the videos presentation in the website of Amenet, and we also have a YouTube channel that you can follow us to see the recorded videos of the entire conference. And if, of course, if both professors give us their permission, we can also share the presentations in the websites and that's it. Well, if you,
oh yeah, no problem. You can share. I have already sent my presentation, so you can share it.
Thank you very much. If there are some questions or comments, this is the moment. Please, I have here one question for Professor Samuel Codjoe. Professor, the analysis that you present here is of great importance, as all human activities are conditioned to health and weather conditions and the quality of life too. You state the need to establish an early warning system, but the effectiveness of an early warning systems also depend on establishing thresholds. For example, thermal stress depends on many factors and, of course, vary across persons and activities in which they are engaged. For this reason, it is important to establish indicators of heat stress or thermal stress in each location and for each activity, even if it is indoor or outdoor. This means that tipping points for each location are necessary inside the health facilities. For example, the number of days per year exceeding that threshold could be interesting. Have you considered this in your field work or your research work? That's the question.
Yes, a very long one, but my thanks to the questioner. Yes, we have. And in fact, the points he made are all very important, because what we may consider as a heat stress in our part of the world may not necessarily be the same as the one that is in the UK or some other areas. I know there are advanced studies in the UK, for example, indicating thresholds of stress. But on the African continent, it has been a bit challenging as to exactly at what temperature level would we say that we've reached a tipping point or a threshold. It's a very difficult question to answer, but we are working on it. In fact, there is a continuation of these projects that I presented to you, where we are trying to now look at what kinds of maybe building structures we can have and what kinds of materials we will need to use so that we can have the optimum temperatures that people will be very comfortable in. And I know, for example, University of Loughborough that we are collaborating with a lot, they are also experimenting heavily as to even the kinds of attire, the materials that people can wear, and that can be able to withstand the heat and be able to still make them comfortable so that they can be able to work under some of these very warm conditions we have. So yes, we are thinking about that it's not easy to have. And if you take a country like Ghana, it is much warmer in the north, obviously, than in the south. And so where are you putting the threshold? But yes, there is a lack of research on the African continent as to how we can be able to establish some of these thresholds. And those are some of the researches we are now pushing. Thank you.
Thank you very much. Is there any other question or any other comment? I'm checking in the chat. I have here another question for Professor Ayee. I would like let me check here. I would like to know if there are. Could you please briefly explain current efforts regarding prevention and recovery of this health emergency in Ghana?
Okay, thanks. Oh, well, yeah, sure, why not? There are, the first thing is that we are being told it is mandatory to wear the masks. If you don't wear the masks, in fact, the law is even draconian. You go to prison for 4 years, but it's not been implemented. You see, as usual, we have very draconian laws, but then the implementation. So because it is draconian, it's not been implemented. So some of them will be asked to do a community work for about an hour, or some of them may be asked to do exercises in case you don't wear the mask. Then you need to follow the protocol. So use of hand sanitizer, the social distancing, etc. Then, of course, the other thing is that the government has reiterated that about the number of people who can go to funerals. You know, in Ghana, we like going to funerals. They form part of the culture. So there is restriction on the number of people who can go to funerals. Government is saying 25 persons, private burials. So you can go to the church, maybe about 200 or 300, but at the graveside, only 25 people will go there. Then, of course, you can only go to church for 2 hours. Anything after 2 hours, you need to have a break and then you go in. But this is not being adhered to. But the point I want to stress is that the protocols are there, but the enforcement is ineffective. So we need to enforce these protocols. And that's one of the reasons our cases are going up. Our cases are going up because people are not observing the program. People are going to parties, they are going to funerals without the protocols. So we need more education. And that's why you see, if we have the vaccines, people will say that once I've got the vaccine, I will not observe the protocol. That's why more education will have to come in. So we need more education on the post-COVID-19 era so that the protocols must be observed. But of course, some of these things are cultural. In Ghana, not to shake hands with somebody is a difficult issue, but people must live with it. That's why people go to funerals and then they forget and shake hands, and then they have the disease, the virus and all that. So what I want to say is that, one, we need to have a coordinated, vigorous public education program. And I think that the public education program is still not as strong as one would have expected. But then we also need citizens to take their lives into their own hands, which means more education. But the final one is that I think enforcement is very important. I mean, in certain areas, if you go to certain districts, they have passed bylaws. So if you don't wear the mask, you have a sport fine of maybe 5 cedis, a sport fine of 2 cedis. Those things may work in the rural areas. So I think that the rural areas or the districts must have their own bylaws, which will enable people to actually observe the proposal. So on the sport fines are very important, or people being asked to do some community service. Thank you.
Thank you very much, Professor. We have another question for you. What do you think are the new avenues in regard entrepreneurship after COVID-19? I mean, the new ideas, the new initiative, the new entrepreneurship investments that are going to appear in this new era, no? Post-COVID.
Yeah, okay, very, very important question. Again, we have realized that COVID-19 has brought the economies of African countries, not even African countries, but the whole world on their knees. There are distortions in the economies and what have you. So what are the new type of entrepreneurship? Governments in Africa have rolled out stimulus packages for the private sector, for small scale industries, etc., etc. But I think that there must be, something. And of course, we have the Bretton Woods institution, of course, also dishing out bailouts to economies. But I think that governments will have to think outside the box and strike out a stronger partnership with the private sector. I always say that public-private partnership is still weak in Africa. And the post-COVID-19 period will have to regenerate a new spirit of entrepreneurship partnership between the public and the private sector. There must be a re-engineering of public-private partnership. That's one. Then, of course, we also need to transform our economies. I always say that our economies are still not, transformed. We still is monocrop economy, not in little or no industrialization, rain-fed agriculture, etc., etc. So we need to re-engineer the economy through more industrialization, through public-private partnership, and through more creative ways of engaging small-scale industries and see how best they can actually accommodate the stress of COVID-19 and move forward. Mind you, most small-scale industries are really disenchanted. They have collapsed. Some of them have collapsed. Some of them took loans and they cannot repay loans, etc. So what I want to say is that government will have to come in. The stimulus package is very important, but there must be a reorganization of the stimulus package and see whether the loans or the amount of money which have been distributed can be actually increased, right? There must also be a way of bringing on board the farmers about their productivity, because whether we like it or not, we need food. And so how can we also entice farmers? And farmers are saying that, look, they have also encountered harvest losses. How can we deal with harvest losses? So it's a whole arrangement of bringing together. And I think that we need a national dialogue on the way forward with post-COVID-19. A national dialogue which will bring all the stakeholders together to brainstorm on how to deal with the situation. And I'm sure at the national dialogue, new ideas or more innovative or creative ideas will come on board for implementation.
Thank you very much. And we have other questions here for Professor Ayee.
Yes.
Professor, how can decentralization can assist in this pandemic era?
Okay.
Decentralization process.
Very important question. You see, if you look at COVID-19 in Africa, it has become a centralized disease. I mean, when it started in African countries, it only affected the urban areas. So the concentration was on the urban areas. So the government adopted a centralist approach or a centralized approach. So all the government institutions in the national capital were involved. The regions, the districts, or the states were not involved. It was only when the disease was spreading to the rural areas that that government suddenly woke up and said, oh, let us deal with the rural areas. You see, you need to build the capacity of rural institutions to deal with pandemics. But the rural districts, the institutions there are weak. So how do you build their capacity? So building their capacity entails more money, entails more powers given them, entails more supervision, entails civil society organizations. I always say that in this pandemic, the civil society organizations were also caught hands down, and therefore they were not as proactive as one would have expected. But of course, they decided, so after getting to the latter part of the year, they came on board. But I think that the decentralization offers a key to dealing with, because you see, the pandemics actually happen in the rural areas. Now we have the outbreak of Ebola virus disease, EVD, in West Africa. And you see, the borders are still closed, but people can go through the unapproved routes and enter villages or the rural districts. So the rural districts should be well equipped enough to deal with these things. That's why I've always said that decentralization is good, because the capacity of the institutions must be built. So you need to have surveillance teams in the rural districts which would deal with these outbreak of pandemics or epidemics, as the case may be. So my point is that decentralization is very important, because whether we like it or not, the pandemics generally, it's unlike COVID-19, which became a central urban issue, right? But that's why we adopted a centralist approach, and now the governments in Africa are now going back to adopt a decentralized approach. So we also need to strengthen the local government units, make sure that they are well equipped, educate people in the rural districts, because whether we like it or not, education has not been strong in Africa. People are perishing because of ineffective education. And the only way by which you do that is to equip the district, the local government units, which will be also able to promote the necessary education, which will deal with some of these pandemics, etc. So decentralization is the way to go in post-COVID era. Very important. And when I'm talking about decentralization, I'm talking about effective decentralization and not centralized decentralization. A functional decentralization system where the institutions are well equipped, where it has the personnel. If you go to some of the districts, they don't have the full complement of personnel. How many doctors in the district? Very few. How many nurses in the district? Very few. How many clinics or hospitals in a district? Very few. So the infrastructure is very important.
Thank you. And you have already answered the next question, which was if it was necessary to change educational programs and training, and definitely yes. Yeah. And last question is for the Professor Atsu Ayee. What are the homegrown policies Africans can adopt in the era of pandemic? The homegrown policies.
Yeah, policy. Yeah, okay. So, well, you see, I always say that we have Agenda 2063, which is the AU blueprint on development, the Africa we want. But you see, all governments have focused their attention on the SDGs, Agenda 2030, which is not good, which I always say that it's not good. So because the SDGs or Agenda 2030 is an international blueprint, most African governments have decided not to use that. So I think one of the ways by which we can have a homegrown strategy is to take a look at the Africa we want, Agenda 2063, which is even longer in terms of duration than Agenda 2030. It has 7 beautiful aspirations, but we are not dealing with that. So I think that the homegrown strategies should start with Agenda 2063. What are the things that we need to do? What are the strategies that we need to adopt? So out of that, we can develop other targets or other homegrown strategies or blueprint which will guide us. I agree that Agenda 2030 is an international development blueprint. But of course, the African Union has also developed the Africa we want, the Agenda 2063, which is very important, which is, in fact, 30 years even beyond Agenda 2030, which is a long-lasting blueprint than Agenda 2030. So let us try and see how we can craft out a more homegrown strategy from Agenda 2063. Thank you.
Thank you very much. If there are no more comments, anyone here in the chat, we are still 40 participants in this session, and I would like to invite Professor, if you would like to share your last remarks, Professor Codjoe, please, this is the moment to do that. And after, if Professor Jose Maria Meya would like to add something, we have 2 or 3 minutes more, please.
Yes, so just to say a big thank you to all of you for the opportunity to present this work. And as we continue to face very extreme weather conditions on the African continent, the issue of COVID-19 is going to aggravate the situation. And so we need to also be finding solutions as to how we can be able to do that. Research, although there is some kind of research going on the continent, it is not up to the scale as one would expect. But hopefully, we think with these little pieces of evidence we are generating, eventually we'll be able to put together a package that can be able to address most of the concerns that we have on the continent. So once again, I thank you for the opportunity. And I look forward to seeing some of the videos on the website.
Thank you. Thank you very much, Professor. Professor Meya and Professor Ayee, if you would like to
yes.
make it.
Okay, so one, we need to take regional integration very seriously. I think that one of the things that COVID-19 has brought is that collaboration and cooperation are very important. Even in the vaccine thing, it was developed through collaboration. So we should take regional integration more seriously than that. The fight against COVID-19 is not a one country affair. We should actually deal more closely with regional integration issues, be more proactive with regional integration. The second thing is that decentralization is very important. If we're able to decentralize, the centralized approach to dealing with issues will have given way to a more decentralized approach where the principle of subsidiarity will be engaged with. I think that's a very important. Finally, you see, whether we like it or not, COVID-19 has taught all of us lessons. It has taught all of us that the world will never be the same again. And if the world will never be the same again, what lessons can we draw from COVID-19? Thanks a lot.
Professor Meya, thank you.
Thank you very much for your challenges that you have pointed out. I'm wondering about the same question, this decentralization, and how to do it, how to carry out these policies, bearing in mind that the local entities, the public entities at the local level are quite weak. So don't you think that it is very important to focus at the political level to enhance the capacity of the local entities?
But no, very important question. You see, decentralization is a political concept. You have winners and losers. And most often than not, central governments will normally lose if they decentralize, because the bureaucrat in the region will not expect somebody to travel all the way to the capital to get approval. So we need stronger political commitment from our leaders. But it's not forthcoming because they are benefiting from weak decentralization. That's the bottom line. That because they are always benefiting from centralization, no bureaucrat, no politician in the national capital will be willing to decentralize. And that's the more reason why we also need to civil society organizations are very important in this case, because whether we like it or not, governments actually listen to civil society. They listen to citizens. So either citizens' action or civil society action. And if they're able to team up, I believe that governments will be more willing to decentralize, because he who is benefiting from decentralization will not be interested in decentralizing because of the benefits, because he will lose all the benefits. So we need to actually put more pressure on the central government to decentralize.
Thank you, Professor.
Thank you very much. Well, if there are no more questions or comments, now we shall move to the first parallel session of today. Bear in mind that we have 3 different groups in this parallel session 1, as well as in the parallel session 2 after. You have received the connection links to all of these groups, so you can participate in those that are more interest for you. Parallel session starts at 3 p.m. Accra local time, but speakers and moderators of each group need to join there at least 15 minutes before the starting, so we can close this session. Thank you very much to the keynote speakers and all the participants, and for the questions that you have presented here. Thank you very much, and see you very soon.
Thank you.
Thank you to everybody.